Okay, we are looking at substitutions that occur within the body based upon movement. If we look at the definition of substitution, it says additional motion occurring at another joint, which keyword fools the patient or PTA into thinking that more motion is taking place at the involved joint. All right. So it's caused by pain, weakness, fatigue, weight that is too heavy, but the big one is poor understanding of the exercise technique. So prevention, proper positioning, stabilization, and good instruction and proper support is the key. So we're going to start at the cervical or neck region first. All right. So the first motion, of course he's in the sitting position, is neck flexion. All right. The substitution, again, will be trunk flexion. He cervically flexes his neck forward. If he wants to fool or make me think that there's more, he's going to also move his trunk forward, which appears or looks as if there's more range. So, to prevent that substitution of trunk flexion, what I want to do is stabilize here at the shoulders and ask him now to flex. And as he flexes, even if he tried to go forward with his trunk, I can stabilize to prevent, so we can only see the motion at the cervical region. The next one is neck extension. Of course, the greatest thing to prevent a substitution is a straight back chair. All right. But the substitution for for neck extension or cervical extension would be trunk extension. So he could try to extend his trunk back. But again, the chair or the back of the chair is preventing. So let's say if he was sitting on the side of a bed or something, then I could hold at the shoulders, because when he comes back, he can extend his neck back. He could still even try, even with that back being there. And I could hold my hand here again at the shoulders to prevent trunk extension and only see the motion at the C-spine and no other joints. All right. Lateral bending, and again we're talking about cervical lateral bending, him leaning his head to the right or to the left side. All right. When he does that motion, it'll be trunk lateral bending to the same side. So if he's going to bring his ear to his shoulder, then if he wants to show me that he has more, he can lean to that side. So what I could do is hold. I can hold down on the shoulders to prevent that motion and go ahead and go to the side. And if he wants to go, I can prevent him from moving to that direction. One that may not be listed in your book, because again, he's trying to show me that he has more range, with the ear being close to the shoulder, is even if he does not lean with the trunk, he could elevate his shoulder girdle and make it appear as if there's more motion. So I want to hold here and push down to prevent. But again, education comes from verbal too. So I am firmly holding down, and I'm saying keep your shoulder down, keep your body straight, and I'm reinforcing it with the stabilization. So he can lean his head to the right. I can push down to prevent and to reinforce, and I can push over to prevent and reinforce. And likewise, the same thing could happen to this side, the trunk lateral bending to that side, and the elevation of the shoulder girdle. And then the last one for the C-spine is rotation, trunk rotation to the same side. So if he tried to rotate his head to the right, he could just keep turning and make it appear as if he has more. So I want to hold, especially on this opposite shoulder, to prevent that turn, or hold on both shoulders to prevent the turn, to make sure that that does not occur. All right, and then likewise to the opposite side. And that covers substitutions for the C-spine.